Welcome everyone to our Saturday speaker group meeting. We have an awesome speaker here today that I'm excited to introduce. We have Lindsey Unger. Lindsey is a speech language pathologist and founder of Converse with Confidence. And the topic today is going to be mindfulness and cognitive rehab. So Lindsey, we haven't had you as a speaker before. I've heard a lot about you. So we're really excited to hear what you have to say today. So welcome, and appreciate you spending some time with us on a Saturday.
Thank you so much for having me. I'm so excited to be here and for being on today to be able to talk with you about a subject that I feel passionate about. Just a little bit about me and my background. I moved to San Diego about 4 years ago from Los Angeles. And when I was in LA, I started my career as a speech pathologist at the VA in West Los Angeles. I worked there with Afghanistan and Iraq vets coming back with TBI. I worked at that VA for a good while, several years, until I moved here. While I was at the VA, I also took on some other side work, also in a trauma center. I worked home health, skilled nursing, kind of the gamut of what you can do as a speech pathologist I've done. When moving here, I worked at UC San Diego Health for a few years until branching off and starting my own business. My own business is called Converse with Confidence, and it is an adult speech therapy company. So, and we see the range of anything you can see as a speech pathologist, but I do work with adults only at this time. So the topic today is about mindfulness, and I wanted to start with the caveat that I'm not a mental health professional, but I do feel very passionate about this concept of mindfulness and how it can be very helpful as a speech pathologist, not only for me personally, but for all of my patients that I see. I feel like everyone can benefit from at least just learning about what mindfulness can do for your own health. Okay, so I'll share my screen here. So here's the topic today, mindfulness and cognitive rehab. And this is again from a speech pathologist perspective. I am very much wanting to stay in my lane as a speech pathologist. So everything that I say today is kind of from my perspective and not from a perspective of a mental health professional. At the very end, I do suggest that if you wanted to learn more about mindfulness or practice mindfulness, it's best to reach out to a mental health professional. And but speech pathologists can incorporate concepts of mindfulness into practice for cognitive rehab. Let's see if I can change the slide. There we go. Okay, so this is generally about what we're going to discuss today, just a little rundown. Just in general, what a speech pathologist does in terms of cognitive rehabilitation. I know you have had a speaker before, speech pathologist, maybe a couple of speech pathologists speak in your group before. So some of this might be new information and some of it might just be a review. I'm hoping that the new information would be interesting for you. Some of the comorbidities related to TBI, otherwise known as the other symptoms that you're dealing with other than the cognitive impairments. What is mindfulness and how is it related to cognitive functioning? There is a very strong correlation here with mental health, what's going on in your own brain, and cognitive functioning, attention, memory, executive functioning skills, very closely related to what's happening with mental health. A little bit about mindfulness research. I won't get too in depth, but just a little rundown of what's been done in the field of mindfulness. And I hope that that will prove a little bit about why I'm talking on this topic today. Some functional approaches to mindfulness, just some ideas you can throw into your daily life, really simple things, and some resources for you, again, talking about the mental health professionals that are specialized in mindfulness. Okay, fancy little transition here. Okay, moving on. So the goals of my talk today. Essentially, I just wanted you to maybe consider mindfulness as a part of your post-TBI recovery toolkit, and also to advocate for that interdisciplinary approach to cognitive rehabilitation. Sometimes the referrals are made to physical therapy, and sometimes they're made to speech therapy. When you're dealing with a traumatic brain injury, there are a multitude of symptoms that really require many specialists to work together as a team to help you the best. Okay, so here's what a speech pathologist does in terms of TBI management. We do the standardized assessments. These are aside from what you might get from a neuropsychologist, where you're in testing for 6 to 8 hours, sometimes more with a neuropsychologist. A speech pathologist will take the information gathered during that exam. Or if you haven't done that exam before with a neuropsych, then we will just dig in a little bit and try to find out what might be the root cause of the issues you're dealing with: attention, memory, executive functioning skills, and language. We give questionnaires, like cognitive questionnaires, about how this might be impacting your daily life. We also do depression screeners. The depression screeners, again, staying in my own lane as a speech pathologist. However, mental health and cognitive function are very closely related to one another, and we will talk about that in a little bit. Informal assessments, like thinking about your language skills, your comprehension, are you able to follow multiple step instructions, things like that. Also, your written language ability. We collaborate with other professionals and make referrals to other professionals as well. We do family and caregiver training, cognitive rehabilitation, of course, which is the one-on-one therapy sessions, and also running group classes. You might know of some of the group classes within our area of San Diego, like Mesa College has that wonderful program. Okay, so these are some of the cognitive impairments that we as speech pathologists are looking at and wanting to treat and also assess. So these are concentration, memory, social communication or pragmatics, language skills, organization and planning, financial management, problem solving, reasoning, your self-monitoring awareness, your mental flexibility, and initiating and completing tasks. Taking a look at this list, it seems kind of extensive. Not everyone will be dealing with every single one of these issues, but it is something that we take into consideration because some of these will really directly impact your quality of life.
Lindsey, this is Kurt, could you explain on that previous slide, metacognitive awareness?
Oh yes, we're gonna definitely go into that.
Oh, good,
So
good.
I wrote there self-monitoring / metacognitive awareness. Essentially, metacognition is your ability to think about your own thinking. It's funny thinking about that, but it really takes a lot of insight and self-awareness to dig into your own mind and say, what is it that I'm thinking right now? Why am I thinking these thoughts? What can I do here to change my thinking around? Or how can I take action on these thoughts? And that's a really high-level cognitive skill that we all need as human beings. This is something you might not be aware of. It happens subconsciously. But as speech pathologists, we're interested in training you to consciously and intentionally think about your own thinking. I hope that makes sense.
Great answer. Thank you.
Okay, so these are the comorbidities I was talking about, the other symptoms you might be dealing with, aside from the cognitive issues. This is why, as speech pathologists, there's sometimes a little bit of a challenge with regards to how successful we are with cognitive rehab. These symptoms right here are a major part of any kind of traumatic brain injury. You might be experiencing some of these symptoms, maybe all of them, and maybe on different days, they might be more severe than other days. Maybe it just varies from hour to hour as well, or based on whatever you're doing for that day. Poor motivation, sleep issues, nightmares, tinnitus or ringing in your ears, sound sensitivity where you can't be around loud sounds or a busy environment, blurry vision, ocular motor changes, meaning your eyes are just not moving correctly and needing that physical therapy or OT for vision therapy, light sensitivity, needing to wear glasses, can't be out in the sunlight, can't be exposed to fluorescent lights, vestibular disorders or balance issues, pain, headaches, migraines, nausea, appetite changes, mood instability, the poor frustration tolerance and irritability, depression, anxiety, and stress. I highlighted there and made stress really large because that's going to be a major topic for today, something that can significantly impact cognitive functioning. That feelings of worthlessness, sense of worry about the future, comparison to old self. I give my depression screener to all of my patients who have traumatic brain injury. And you would be very surprised as to how many people will mark off the feelings of worthlessness, their sense of worry about the future in comparison to their old self. Slower processing speed as well. feeling like, okay, I know what this person is asking of me, but now I have to process the information, and it's taking me a very long time to process what I want to say, comprehend what they actually said to me, and be able to give a meaningful response. So stress is highlighted there, but taking a look at all of these comorbidities again, that seems like quite a bit, right? Even suboptimal sleep, meaning you're waking up multiple times a night, you're having a hard time getting to sleep, you wake up super early, you wake up with daytime fatigue. Think about just that alone can impact every single one of these cognitive functions. Pain alone can impact every single one of these cognitive functions. Stress alone can impact every single one of these cognitive functions. So you take any one of those comorbidities in isolation, and it will impact your cognitive functioning. But if you think, wow, this is a really, really extensive list, think about how much more that's going to impact your cognitive functioning. That first thing on the list is concentration. If you're feeling in a mental fog from not enough sleep, from pain, from all of those other issues, concentration is going to be off, right? Not able to concentrate or focus your attention on something, on a desired task. That's going to then have a direct impact on memory. If you can't concentrate on something, the information isn't filtering in, the information is not encoding, and that way memory will be directly impacted. So it seems like concentration is the first place we need to look as speech pathologists. All of these other tasks, these cognitive skills, rely on concentration. Your ability to memorize, your social communication skills, your language skills, organization, everything requires good concentration. It kind of boils down to that. So that's usually the first place I start as a speech therapist doing cognitive rehab. So let's talk about stress. I highlighted that on the previous slide, and its impact on cognitive functioning. Okay, so you may have heard of this hormone called cortisol. This is otherwise known as the stress hormone in the body. All right, so your body is hardwired to react to stress, and that's basically meant to protect you against predators. Think of, when humans were first around, that's what our brains had to do, was protect us from predators. So everyone does have stressful demands, but we might not be chased by predators all the time, but your brain reacts the same. The brain doesn't know. So essentially it's that fight or flight response that your brain is reacting to when you're under stress or when there's aggressors in your environment. Following a TBI, the stress levels can be especially heightened. There's PTSD, post-traumatic stress disorder, that can be a part of this. Financial stressors, think about the amount of stressors that you might be experiencing in your life. Those stress levels can be heightened and then stay heightened for an extended period of time. Whereas everyday stress for someone who hasn't had a TBI might kind of ebb and flow, might come as a situation is encountered, but then you go about your daily life and the stress levels start to decrease. When you have a TBI, those stress levels tend to stay heightened at a longer period of time. Therefore, those cortisol levels are also heightened for a longer period of time. The body treats the stressors as threats, and the hypothalamus in the brain is a tiny region at the base of the brain. It sets off this big red alert alarm system to signal the release of that hormone cortisol, also adrenaline. So think about if you have this constant exposure to the stress, cortisol is constantly being released. When stressors are always present, that fight or flight reaction stays turned on, and the long-term reaction and the overexposure to cortisol can disrupt almost all of your body's processes. And studies have shown that continuous exposure to cortisol can actually deteriorate some of the brain functions over time. Now we're starting to see why stress is such an important part of cognitive rehab. If we can manage stress, you can almost hypothesize that cognitive rehab will go better. But if you have that constant stress and that's never dealt with, these are the things that can be a result. And this is just a very short list of some of the things that can go wrong. Anxiety and depression can be triggered, digestive issues, headaches, pain, sleep problems. And there it is, concentration and memory impairments direct from stress. I put a, okay, I don't know what I did with some of these transitions. Sorry, I was trying to get fancy. Okay, so moving on here. Excuse excuse me, allergies picking up. Okay, so clinical studies have found that elevated cortisol is associated with poorer cognitive functioning, episodic memory, meaning memory for certain events that have occurred in your life, executive functioning skills, planning, attention, organization, reasoning skills, things like that. Language skills, the ability to find words that you want to say, processing the sentences, formulating sentences, spatial memory, processing speed, and social cognition. So again, sounds like stress reduction may be helpful. When we're speech pathologists trying to treat the cognitive impairments associated with TBI, and somebody has not dealt with their stress, they haven't been treated, they're not under current care, they're not doing anything independently to treat their stress, cognitive rehab tends to go very slowly, and the results tend to be not as great as somebody who's enrolled in some kind of mental health program, or they've already worked on mindfulness strategies, or they're doing meditation or yoga. Okay, these are the tasks that requires our full attention. This is not a full list because almost everything you do in your life, any task is going to require your full attention. Even this lecture we're doing right now requires your full attention. If there's anything in your environment right now that's taking your attention away, or anything within your own body that's taking your attention away, we're already having a concentration breakdown, which is going to impact your memory for what happened here today. But reading, driving, having a conversation, studying, listening to a lecture, watching a movie, completing work projects, anything you do requires sustained attention, really. Your full attention. What happens when your mind is wandering or goes to a fog when you're trying to sustain your attention? Instead of this spotlight that we kind of want our attention to look like, where we can really hone in on what we want to concentrate on, it's very intentional, we're having a conversation, this is what I'm paying attention to. You're dealing with more of a spotlight situation where your attention could be directed at a multitude of places. Essentially, you're having a really hard time controlling where the light is pointing to, where your concentration is going. It could be going haywire, or it could be kind of dead set on something that's not a functional task. You could be 100% concentrating on your Facebook post right now, rather than this conversation. And that makes it very hard to remember what we're talking about, right? And stress can make this spotlight or searchlight situation much worse. Okay, so the multitude of TBI-related comorbidities that we talked about before, stress and the vision issues, tinnitus, sleep problems, pain, increases that distractibility, and the inability to inhibit the attention shifts, where your attention is going. Okay, how does this manifest in TBI? Okay, these are the things I see very often in my questionnaires when I give to patients doing an assessment. Pretty much everybody that I see will, in one way or another, say, yep, that's me, yep, 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 all the way down the list. Trouble maintaining concentration, even with mild traumatic brain injuries or concussion, trouble maintaining concentration seems to be a big one. Difficulty blocking out distractions, concentrating while reading, multitasking, remembering appointments, trouble remembering medications, difficulty remembering to pay bills, getting organized, completing household tasks, recalling the sequence of steps to complete tasks. Like at work, you might have a project or something that you're doing that requires step 1, 2, 3, 4, and 5, but you're having a hard time remembering what comes first, second, third, fourth, and fifth, and following through with the steps. Trouble remembering the location of your items, or losing your wallet, your keys, your phone, your hat, your sunglasses. Difficulty remembering names, even names of people that you feel like, oh, I should know that person. I've been exposed to that person and their name for a little while, and I still don't know their name. Difficulty remembering details of conversations like what we're doing now, how much of this information will seep in and how much of it will get kind of tossed away. Difficulty remembering directions, especially if directions are said to you. Are you able to remember those instructions? Especially if they're multiple steps, can you remember all steps of the instruction? And difficulty retaining or encoding new information. Again, most of the people that I see, even with the mild traumatic brain injuries or concussions, will kind of tick off every single one of these. So if you're experiencing any one of these, I want you to right now kind of dig into your own thinking, use the metacognitive awareness, and try to ask yourself, where's my concentration when all of these tasks are taking place? Where is my focus when these tasks are trying to take place? Am I having brain fog at the time? These issues kind of all boil down really to concentration if you really think about it. Also, thinking about concentration, it does have a direct impact on memory. So yes, it does have something to do with memory as well, but it starts with concentration. Sounds like optimal concentration is necessary for activities of daily living, paying the bills, getting tasks done, doing things at work, following directions. Okay, here's the traditional things that we as speech pathologists work on. And if you've been to cognitive rehab, some of this might look familiar. Redirection techniques such as tallying every single time you notice your mind is starting to go adrift. Limit distractions, of course, like turn off Facebook or minimize the amount of tabs you have open on the internet. Or there's the radio on and that seems to be distracting, so let me turn that off. It does take a certain amount of metacognitive awareness to realize when you're distracted. Practicing functional attention tasks, like we know that you have to listen to an audiobook for class, let's say. So we practice those redirection techniques in the reading types of strategies while you're reading out loud or while you're reading silently. We'll practice those functional tasks in therapy. There are cognitive therapy apps. That is a talk for a different day. So computerized cognitive rehab, that is a whole separate topic, but there are apps breaking tasks down into smaller bits so it feels more manageable. Frequent breaks, so noticing when I'm reading, I can only sustain my attention for 20 minutes. I'm only going to read for 20 minutes and set a timer for my little break after 20 minutes and then come back to it. I'm going to make a little stop note on my reading page of where I left off so it doesn't take me too long to transition back after my break. Again, these are things we teach in cognitive therapy. Frequent, prioritizing. This is really important because I told you sometimes we work on breaking tasks down. We work on breaking down your schedule, but prioritizing those tasks for, let's say, when you feel the best, might be the morning time. So you're going to take the task that requires the most cognitive effort and put that in your morning schedule. The tasks that require the least cognitive effort, you're going to do maybe later on when you're not feeling as great. We do scheduling and planning assistance to help you plan your day better. Focus on one task at a time and avoid multitasking. I read some study from a neuropsychologist that mentioned only 3% or somewhere around there of people are actually able to multitask, where they can pay attention to two things literally at the same time and get with the same cognitive complexity, and they're able to have the same outcome with a good positive performance on both tasks. 3%. Most people think, oh, I'm so good at multitasking. Multitasking is a very difficult thing. So we tell people to try to avoid multitasking, or when you have to, you're going to pay attention to the cognitive complexity of the tasks and take breaks. And we all, do all sorts of compensatory strategies for that. Allowing more time to complete tasks, dealing with the scheduling part of that. Practicing use of associations when you want to remember something like someone's name. My name is Lindsey. How are you going to remember that? Let's associate my name with Lindsay Lohan. You won't forget that. Okay. Using vivid images. So taking something you're trying to learn and you're going to create a vivid image in your brain. You could even draw out a little doodle of it. Repetition, repetition, repetition. You want to learn something, you're going to have to repeat it not once, not twice, but probably 3 or 4 times. And depending on the cognitive complexity of the information, you might have to repeat 5, 6, 7 times. And repetition can come in the form of saying it out loud, writing it down, and just thinking about these things multiple times. mnemonic devices, putting things in an acronym style, putting belongings in one location so you don't lose your keys, your wallet, your phone, your glasses, your hat, keeping a journal or a notebook. It doesn't have to be extensive, but like a 1 sentence, 2 sentences at the end of each day where you try to look back at your day and notate what you did, what conversations you had. Use of electronic devices. So we live in a cool day and age where we have all sorts of stuff. We have the reminders app, the calendar app, the voice recorders, smart pens. You got your iPhone calendar, there's Google Calendar. So many cool things that you can find on your electronic device to help with memory. There's medication reminder apps. There's the SQ4R, memory palace types of reading strategies that if you don't know about those and you're having a hard time reading, I would look up. I would take note of those things because it can be super helpful, but we don't necessarily have time to talk about each one separately. But SQ4R is a reading strategy. Stands for survey, question, read, review. There's one more R I'm forgetting right now, but SQ4R, also known as the square method for reading. And then the memory palace, also very useful. Those are the traditional things, amongst other things that we work on as cognitive therapists. Okay, so here's where mindfulness should be incorporated, because take a look at all of these things that we're working on. I feel like if you're still dealing with significant stress, severe sleep dysfunction, severe pain, all of those other comorbidities, it's going to make all of these things we're trying to do as therapists extremely difficult for you. Think about, you know, you got to limit distractions, but you're feeling super stressed. That's a distraction in itself. So here's where mindfulness can be incorporated. Okay, what is mindfulness? Has anyone done mindfulness training or yoga or meditation or anything where you are kind of forced to deal with what's happening right now in the present moment? So mindfulness is essentially you bring your complete attention to the present experience. What's happening at this very second? What's happening with my body? What's happening with my breath? What's happening with my mind? How am I feeling? And, you know, thoughts that are running through, and just being okay with it in a very non-judgmental way. And you're essentially going to like look at yourself from an outsider's perspective and say, what is happening? And then look within and say, okay, how does that feel to me? And this is a stress reduction technique. It's called mindfulness stress reduction, essentially, mindfulness stress training. So this is a stress reduction technique. I highlighted attention and stress because, again, I pointed out that those two can be very much interrelated. It is a form of mental exercise that has to be practiced just like any other exercise. It's kind of like meditation. Somebody saying they practice meditation, it does need a certain amount of regular practice for it to become ingrained in you to think this way and for you to use these skills. Like any other exercise, you have to practice to get better at it. Sometimes it can get frustrating. Sometimes you can try an exercise and it doesn't work and you feel let down. But again, you come back to it and you try harder and you keep going. And then you see where you're at. See if I can change this. Hang on a second. Here we go. Okay, so here are some of the benefits of mindfulness. It does improve metacognitive awareness, your ability to think about your own thoughts, just as Mary was talking about. Decreases the looping or negative thoughts. Enhances attention capacity through improvement in working memory. Working memory is a type of memory where it's essentially sensory memories. So information comes in through your senses, your eyes, or you're hearing something, or you feel something, or you do a task. And that information goes into just like a surface level of your memory. It stays there for a little bit of time, just a few seconds. And then that information decides where to go in your brain further from there. If you're gonna be exposed to this information again, you might say, this is important to remember. And that working memory might then get more ingrained or encoded into your memories. If it's a working memory, like just sensory information, like I passed a stop sign on my way to work today, your brain is going to ignore that because it might not be useful for you unless you are specifically paying attention to that stop sign or need to know, or it's important to you for some reason. The brain is very good at shedding the information that you don't pay attention to. We only have enough cognitive resources for so much, and then our brain has to get rid of the rest. Decreases stress. Mindfulness can decrease stress, huge, and increase cognitive flexibility, or adjusting your attention and behavior according to changing environment, like task switching. It improves your emotional regulation, and we talked about a big component of having a TBI. One of the symptoms is difficulty with emotional regulation, irritability. Your frustration tolerance is lower. Relationship satisfaction, interestingly enough, enhances self-insight, enhances immune system functioning. It lowers your respiratory rate and your blood pressure. Reduction in psychological distress, increased information processing speed. We talked about that as something that we as speech pathologists try to help with in our therapy with you, but mindfulness can also help with that. Decreased task effort. I have a study in just a little bit that's going to show how that improves mental fatigue with the task that you're doing, and improved quality of life. This is a lot of benefit from a concept like mindfulness. Improved mental fatigue. Okay, so here's where I'm going to talk a little bit about the research. I'm going to try not to get too techie with some of the terminology, but I think it's important to kind of back up my theory that mindfulness should be incorporated in cognitive rehab. Hang on. Okay, there it goes. All right, so here's the name of the study. Mindfulness-based stress reduction improves long-term mental fatigue after stroke or brain injury. The objective of this study was to see if mindfulness training improves mental fatigue. Patients who suffer from mental fatigue after a stroke or brain injury have reduced capacity for work and participating in social activities. I see mental fatigue with the simplest of tasks on my assessment measures, even for patients who have had mild traumatic brain injury. I might have that patient look at, where is this line pointing? Which angle is it pointing to? And that will lead to someone ending up in tears. That just happened to me, and she had a mild traumatic brain injury. I had somebody last week who we were doing a task of trail making where she had to alternate her attention back and forth to symbols. I'll show you that in just a minute. And that led to a major headache, and she was wiped out for the rest of the day. So the aim of this study here was to implement a non-pharmacological strategy aimed at improving mental fatigue and just the overall condition of these patients. They started out with 18 participants with stroke, 11 with TBI. Everybody experienced mental fatigue based on those self-assessments like the ones that I give. 15 patients were randomized into the mindfulness-based stress reduction program. They went for 8 weeks. That's about the typical length of time for there is like an accelerated program for mindfulness, but the 8 weeks seems to be the median time that people are doing this program. While 14 people served as the controls. They didn't receive any active treatment at first, but then they were offered 8 weeks following the initial set of patients. And the results were that statistically significant improvements achieved on the self-assessment measures for mental fatigue. They did these psychological tests with these patients to determine how fatigued they were before and after. This is a digit symbol coding task that sometimes we give. And I don't know if you've ever done cognitive assessments with neuropsych or with speech, but this is a common one where you have to take these symbols that are correlated with the numbers at the top, like this backward C is a 1, and all the blank spaces down below, as fast as you possibly can, you have to decode the symbols. So equals would be a 7, the next little sideways T would be a 6, and you have about 90 seconds to get as many as you can done. Pretty mentally fatiguing for your eyes. Also can lead to headaches, and we assess what's going on in your body and your brain when you do the task, and also your speed of processing, how many can you get done. And this is the trail making task that I mentioned I did with somebody, and it led to her being fatigued for the rest of the day. It bothered her eyes for sure. You have to draw a line starting from the smallest dot, which is right there in the middle, to the smallest triangle, which is up at the right. And then you have to go to the next biggest dot, to the next biggest triangle, to the next biggest dot, to the next biggest triangle. And you're going to end at the biggest circle and the biggest triangle. So something as simple as that. And this girl is a PhD student that I just mentioned, has significant difficulty with this, led to severe mental fatigue. So mental fatigue is a huge one in terms of what we're dealing with as speech pathologists. Here's another research study. Mindfulness training modifies subsystems of attention. The objective here was to investigate the hypothesis that mindfulness may alter or enhance specific areas of attention. And here's their methods. They provided 2 types of mindfulness training and did pre and post-treatment behavioral testing. They used the psychological test, attention network test. One group participated in that 8-week training, like we talked about, is about the median amount of training for mindfulness. And that does emphasize concentration and meditation. And the other group participated in the 1-month intensive retreat. And the performance was compared to a control group where they had no experience with mindfulness or meditation at all. Both of the groups demonstrated improved performance on the post-treatment assessment measures. So essentially, they're making this hypothesis that the mindfulness training will improve attention and behavioral responses. Okay, here's one of the most interesting studies that I found. Love this one, and it was a little new information for me, actually. This was a 2006 study, meditation experience is associated with increased cortical thickness. All right, let's talk about cortical thickness for a second and what that means. So really quickly here, cortical thickness, I'm going to put this up on a different screen, but cortical thickness is related to intelligence and closely linked to cognitive ability. So I have a little picture here just kind of showing what cortical thickness means, what that definition means. Cortical thinning is a normal part of aging, but accelerated cortical thinning in vulnerable regions, especially like language areas, memory areas, can be a biomarker for Alzheimer's, those neurodegenerative disorders that can happen later in life. Thinning of the cortex has also been shown in TBI in certain areas of the brain. So cortical thickness is a good thing. So here the study is looking at the cortical thickness of patients. The hypothesis here is that meditation practice might be associated with positive changes in the brain's physical structure. So there was MRIs done, these functional MRIs, where they could see parts of the brain lighting up. It was used to assess cortical thickness and brain activity in 20 participants with extensive meditation experience. And that essentially involves, again, attention to what's happening inside of your own body. The results of this study, brain regions associated with attention and sensory processing were thicker in meditation participants than matched controls. And let's take a look here. Okay, here is one of the diagrams here, just kind of showing the increased cortical thickness. And this is a diagram showing that increased cortical thickness was directly associated with a positive or a negative change in breathing rate. So essentially, if you have the thicker cortical lining, that your respiratory rate tends to be a little bit lower, which is a good thing because it doesn't set off that fight or flight response. Okay, here's some examples of mindfulness exercise. These are some exercise that we as therapists might incorporate into your training. Maybe some therapists might not, but they might be helpful. Okay, this one is called using your five senses. So our five senses, vision and hearing and touch and smell, we're going to be using vision first. What sights do you find calming? So find something in your environment right now that you find calming. Maybe it's a picture, maybe it's a color, maybe it's a texture. Maybe you open up, on the cover here of my phone, I have pictures of my kiddos. You might find that calming. So you're going to find an image that you really find calming and that you enjoy looking at it. And you're going to really sit there and look at it. You're not just going to glance at it. You're going to look at it like you're looking at it for the very first time, that you've never seen something like this amazing thing before. You're going to look at the texture. You're going to look at what the gradient is on the picture. Look at the bright colors and how they make you react. This could also be going outside and noticing the night sky, observing a sunset. You take a walk around a pond and notice the ripples on the water. You're essentially looking at details. When the feelings of stress start to come over you, you can also take a brief moment and notice something that's calming. But this is a training that we have you do to focus your attention on purpose intentionally. And what a wonderful thing that is in terms of being able to control where your focus is. We try to hopefully turn that around to doing a functional task like, we have to read this book right now. Let's see if we can use one of these strategies to help you focus on this book right now. But we have to practice to get better at being able to use your five senses to help control your attention. So starting with vision. Next, moving on to hearing, thinking of something you like to listen to. Maybe it's jazz music or classical music, ocean waves. I love ocean waves. I have an app called Insight Timer, and it has really wonderful meditation music on there that I like to play when I'm typing up notes. It just helps me work a little bit faster. It is calming and relaxing and soothing. Can help me focus my attention for longer. Going outside, listen to the sounds of nature. Put ocean waves on while you're trying to concentrate on something. Put the sound of rain or something you enjoy listening to. Okay, here's how we could use the sense of smell. Find your favorite scent. I love lavender oil. For some reason, just love the scent of lavender. Not everyone loves that. Maybe it's your favorite laundry detergent. Maybe it's a soap that you like. Maybe it's a deodorant that you really like the smell of. And you're going to purposefully, intentionally have that around you when you're trying to concentrate. Have it around you all day long. So you're going to do that intentionally for that aromatherapy. But also, you can check in with yourself when you're feeling stressed. Take in a really long, deep breath. Inhale that scent in, exhale it out, and keep going until you feel a little bit of a sense of calm, a little bit of a sense that you are controlling your attention at that moment. With your taste, enjoy a snack, a treat, but do it mindfully, meaning that you're going to savor every single bite. What is that bite making you think of? What does it look like when it's in your hands? And when you put it in your mouth, what is the sensation your tongue is getting? And what is, memories that are coming up when you're tasting that food? That's eating mindfully. It's not like, okay, I'm really hungry. I'm just going to get food in me so I don't feel hungry anymore. This is intentional, on purpose. You're going to focus your attention on taste. Touch. Identify something that feels good to you. Maybe it's like your chair or your couch or a piece of fabric you really enjoy. And you're going to purposefully feel that, whatever it is. It might be the cold air outside. It might be the sun on your skin. You're going to purposefully go outside and feel that sun on your skin and see what thoughts come to mind. See how it makes you feel inside to have just a little bit of peace. Here's another mindfulness exercise. So it's kind of silly. The Raisin Exercise. It does not have to be done with raisins. You can do this with any food that you like, but it should be a food that looks kind of interesting. Like I did this exercise with somebody who had a piece of kale, and kale is kind of interesting if you like really look at it, it's got all these weird little lines and veins everywhere. It's got like texture, and that looked interesting. So we did this Raisin exercise with Kale instead. In this exercise, you're going to hold this food like you've never seen it before, like you're an alien coming down from space and you have just never seen this earth before, and you're holding this object in your hand like, wow, in complete astonishment. You're going to focus on the way it looks, how it feels in your hand, how your skin responds to it. Smell it, bring it up to your nose and take a huge whiff of it. Try to think about all these thoughts that are going through your mind when you're smelling it. Think about its taste. This is intentional, on purpose, focusing your attention on something that's right here in front of you. You'll be unlikely to be expending your energy, time, and attention on worrying about other parts of your life. Even if it's just for these 10, 15, 20 seconds, 30 seconds that you have these raisins or kale or whatever it is in your hand. That means and proves to you that you have an attention span and that you can focus it on something that you desire. Okay, here's another mindfulness task. Watching your own movie. Kind of seems a little silly, but okay, so imagine you're observing a movie. You have to describe every single detail that's happening to somebody else, your partner, your husband, your wife, and you have to pay special attention with every single detail. Be super clear so that person can almost visualize what this movie is about and what's happening. For this exercise, the movie is about your life, and you're telling the story to yourself, not to somebody else. You're going to focus on what you're doing, every sensation happening in your entire body. Be specific, talk about what's happening with your breathing, where your thoughts are, what your feet are doing, what your posture is like, where is your head, what does your face feel like, and what's happening in terms of your fatigue. You're essentially explaining every single tiny little detail in this little movie about yourself. What this is doing essentially is most of the time, we as human beings are living on autopilot. You come in from work, you toss your keys down on the table and you walk away and you go make yourself a snack. And this is autopilot behavior. That doesn't work so well after a traumatic brain injury, because that means you will lose and misplace your belongings. You will not be paying attention to the things around you because you're on autopilot. You're driving and you forget where you're going because you're on autopilot and not focusing your attention on what's happening right here and now. That autopilot's not going to work. So this is where mindfulness training comes into play. I have a lot of patients telling me, I'm getting lost while driving. And I'm driving to places that I know I should be able to get there without getting lost. I even have the GPS on going in the background. Why am I still getting lost? This is because your brain is on autopilot. So you do have an attention span. It's a matter of where is your attention. Stress, pain, fatigue, all of those things is going to force you to go on autopilot even more. So you have to fight against that and try to get off of autopilot and be here in the present moment. And that's a very difficult thing to do, but it is possible. Even for like these 15, 20 seconds that you're looking at the raisin, or you're watching your own movie, or you're doing these other mindfulness techniques, it is possible to control your attention, but it has to be intentional. Okay, here's some resources. I talked about the Insight Timer app, which I absolutely love. I believe the Calm app now has like a subscription process going on. So I don't know if that's free anymore. It might be for medical professionals, but I don't know. There are other apps to help with progressive muscle relaxation, deep breathing, things like that. Those apps are fantastic. There's the International Mindfulness Teachers Association website, or imta.org. You can find a local certified mindfulness teacher to look into doing those programs that we talked about, the 8-week program and the intense program. There's also the UCSD Center for Mindfulness. They offer the similar types of programs. You could also ask a psychologist, a psychiatrist, other licensed healthcare professional about referrals. And that is about all for today. I wanted to see if anybody had any questions. Yes, you're welcome. Yeah, it is interesting if you have to multitask for work, or at home, you know, as a mother, I have to multitask constantly. Take a look at what it is that you have to multitask with, and what is the cognitive complexity of the tasks you have to get done at the same time. If the one task is going to require huge cognitive effort for you, like if I have to type up an assessment report at the end of the day, that requires a lot of cognitive effort. I might not be able to have a full-on conversation with somebody because that also takes a high cognitive effort. But I might be able to do a little something in the background, like answer a quick email or something like that. But like you said, is that true multitasking, or is it me just being able to rapidly switch between tasks, which is a different area of attention completely? So, or make a lunch in the morning for my 5-year-old and also, you know, talk with them while they're eating. That seems like, okay, those tasks have a little bit lower cognitive complexity, but still, if I'm doing those two things at a time, something might go a little slower than what I had anticipated because I'm trying to just focus on too many things at once. Or my conversation might have a little bit of word finding issues, or I might be processing information a little bit slower. Like if they ask me a question, I might be processing that question a little slower than I normally would because I'm busy making the lunch. So, you know, take a look at the tasks that you have to do and ask yourself, do I have to multitask right now? Or can I get by with just doing one task at a time and prioritizing?
Well, Lindsey, I just wanted to really thank you. What a wonderful presentation, and just so many, you know, reminders that are so relevant to all of us, you know, living in this world today. It seems to be speeding up and going, everything goes faster. And so just really appreciate the topic. I think it's highly relevant. So again, thank you for spending some time with us. Appreciate you.
Thank you so much for having me and for tuning in today. If you do have questions, I have my email. You can email me.
Oh, awesome. Thank you so much.
Yeah, no problem. Thank you, everybody.